Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about identification and classification of neonates with infections, and also we will see about what are the methods we have to follow in order to prevent the neonatal infections. So before proceeding into the topic, we must know why we have to identify and classify the neonatal infections. So when we can identify the infection is if the mother during her antenatal period itself, if she is having any suspected infections, we can suspect that the baby may also develop these kind of infections. For example, if the baby is being delivered by the vaginal delivery, the baby will sweep the perineum, in which the infection, if the birth canal is being infected, that infection will get acquired by the neonates or the newborns. So in that way the infections gets transmitted from the mother to the baby, and also sometimes after the baby is being born, if we are not following the proper aseptic techniques, also the baby may develop the infection. So we will see one by one in detail. So perinatal infections, especially neonatal bacterial infection, is the commonest cause of neonatal mortality in India. Infection can occur in intrauterine life or during the delivery or in the neonatal period. So neonatal period that is from the 0th day to 28 days of their the day when they are born. The neonates are more susceptible to infection because they lack in the natural immunity and take some time for the development of the acquired immunity. So far the baby is inside the womb. So once the baby comes into the extrauterine life, the baby's immune system is very immature, so they are more susceptible to the infections. So during the antenatal period, the intrauterine infections may occur due to various microorganisms and described with an acronym of STORCH. So S for syphilis, T for toxoplasmosis, O for the others, that is gonococcal infections, R for rubella, C for cytomegalovirus, and H for herpes simplex virus. So if the mother during her antenatal period, if she is developing these infections, that is syphilis, toxoplasmosis, gonococcal infections, rubella, cytomegalovirus and herpes simplex virus, there is a chance of transmitting the infections to their offspring also. So the infections can occur during the mother during her antenatal period, or also during the intranatal period, and also after the postnatal period. So once the baby is born also, due to the various reasons, the baby may develop the infections due to their compromised immune functions. So next is these infections can develop due to direct transplacental transfer of the following placental infections. So ascending infections with contaminated liquor, amni, and amnionitis related to infected birth passage and premature rupture of membrane may also lead to the intrauterine infection of the fetus. So during her antenatal period, if the mother has developed any infection means, so once the baby comes out from the infected birth canal, so the baby once is coming out, the baby will sweep the perineum, by which the infections get into the baby's body. Maybe it gets affected to the baby's eyes, mouth, oral cavity or the skin. So in that way, from the antenatal period, through the transplacental transfer also these infections takes place, and also during the birth, during the intranatal period also, if due to the infected birth canal also it can takes place. So during the intranatal period, a neonate can be infected during delivery. So maybe the aspiration of infected liquor in prolonged labor following the early rupture of membrane, which may lead to neonatal aspiration pneumonia. So infection may occur due to repeated vaginal examination by the delivery assistant, especially when the membrane is ruptured. So when during the delivery, during the mother is being delivering the baby, at that time what we as a nurses do is we do the per vaginal examination. So in order to identify in which station the baby is, what is the cervical dilatation. So if we are performing this per vaginal examination for more times, for multiple times, there is a chance of transmitting this infection to the babies. So baby can develop this infection during the intranatal period also. So not only the baby will develop the infection from the antenatal period, but also during the delivery, that is known as the intranatal period. At that period of time also, the baby may develop the infection due to the aspiration of the infected liquor. For example, if the baby has passed the meconium inside itself, if the baby is being aspiration of those liquor can also develop this infection. Next is the infected birth passage may infect the eyes, mouth and the neonates, leading to ophthalmia neonatum and oral thrush. So if the mother is having candidiasis infections, means during the delivery of the baby, so the baby will sweep the perineum. At that time those candida bacteria gets into the baby's mouth and eyes. Next is postnatal period. So transmission of infection from the human contact or caregivers, especially from the infected hands of the mother, family members and healthcare providers. So only we educate the caregivers is you have to strict the family members to visit the baby. So because what happens is, so maybe due to the infected persons, that infection will get infected to the newborns also. So if we are not following the proper aseptic technique, that is whenever we are handling the baby, if we are having the dirty hands or infected hands, or we are susceptible, we are as a caregiver, if we are very immunocompromised, we are having an infections, that will get affected to the baby also. So these infected articles of baby care and contaminated clothing, invasive procedures without aseptic techniques, infected environment around the neonates at hospital, health center or home, and also sometimes the cross infection also occurs. So in the hospital itself, if we are not following the proper aseptic technique, that is proper hand washing or proper hand rubbing, so if you are handling the baby without hand washing, so there is a chance of cross infection also. So from one baby, that infection will transmit to the other baby also. So as a caregivers, we must be very careful while handling the babies, and also in order to prevent the cross infection in the hospital itself. And also during the postnatal period, the infection is mainly due to the transmission of infection, that is human contact. So we caregivers, family members, siblings, everyone come, we have to follow the proper aseptic technique, that is proper hand washing, then only the infections will not get affected to the newborns. Next is factors responsible for the neonatal infection. One is low birth weight infants. Why? Because they are immunocompromised. Contaminated intrauterine environment like prolonged rupture of membrane, unhygienic and multiple vaginal examinations, meconium stained liquor and etc. So infected birth passage and infection at birth in delivery room or neonatal carry-unit. So birth asphyxiated babies and the baby who requires the resuscitations also may develop the infections. Next is congenital anomalies. So already they are having the by birth they are having some of the anomalies related to the respiratory system or cardiovascular system or orthopedic system. So they have the immunocompromised babies, so they are more susceptible to the infections. So various neonatal procedures with inadequate asepsis during the IV infusion, parenteral medications like IV, IM, subcutaneous or oral medications like that. Next is endotracheal intubations, assisted ventilation. So some of the procedures if we are doing on the babies also, if we are not following the proper aseptic technique, that is not following the sterile technique during the procedures, that will cause the infections to the babies. And also other than human milk, if we are giving the artificial feeding, also there is a chance of developing the infections in the neonates or the newborns. So why? Because we are going to introduce the foreign particle into the body of the babies, so that will cause, if you are not following the proper sterile technique, that will cause the infection in the babies. Next is common infections in neonates are, the neonatal infections may occur as a superficial and localized or systemic. The common sites of superficial infections are eyes, skin, umbilicus and oral cavity. So when, as I've already said, the once the baby comes out from the vagina, that is the vaginal delivery, the baby will sweep the perineum. At that time, those infections, if the birth canal is being infected, that infection will automatically get acquired by the newborn babies, that is eyes, nose, oral cavity, skin and umbilicus. The systemic infections also include the septicemia. So septicemia means it is a clinical name of blood poisoning, that is due to various germs, virus, bacteria and fungi, and it may cause sometimes septic shock also. And meningitis, it means the inflammation of brain and spinal cord membrane. And pneumonia, that means infection that inflames the air sacs in one or two lungs and which may fill with the fluid. Next is necrotizing enterocolitis. It is a very life-threatening intestinal disease that affects the premature or sick infants. It occurs when intestinal lining dies and becomes inflamed, so which can lead to bowel wall being destroyed. So this causes the hole in the intestine and that allow the stool to leak into the abdomen. That is very dangerous and infection. It requires immediate surgical intervention. And next is candidiasis. That means it is a yeast infection, so that causes the oral thrush or painful white or yellow patches on the tongue, lips, gums, palate and inner cheeks. So when the mother is having the candidiasis infections or bacterial infections, so that will being acquired by the newborn when the baby is having being coming out from the infected birth canal. So that times it will get acquired to the baby's tongue, lips and gums. So next is disseminated intravascular coagulopathy. That means it is a uncontrolled bleeding and clotting in the newborn. So next is pyelonephritis. Pyelonephritis means it is a kidney infections. So due to the bacterial infection that causes the urinary tract infection, that will also affect the infection of the kidneys. That's all about the common infections in the neonates. So these all are the infections. That mostly common sites of the infections are eyes, skin, umbilicus and oral cavity. And the same way, when the infection is being acquired by the baby, that will cause a systemic infections also, like septicemia, meningitis, pneumonia, necrotizing enterocolitis, tetanus neonatum and systemic candidiasis, scleroderma and disseminated intravascular coagulopathy, pyelonephritis and osteoarthritis. Intrauterine infection may be manifested at birth or delayed for few days to several weeks. So once the baby is born also, when we are doing the essential newborn care or the immediate newborn assessment, so translational assessment also, we can identify whether the baby is affected with any infections or not. So common infections are ophthalma neonatum, umbilical sepsis, that is omphalitis, oral thrush, pyoderma. So pyoderma means it's a group of skin infections due to the pus forming bacteria, and neonatal sepsis and necrotizing enterocolitis. So these are some of the infections that is being acquired by the neonates. So prevention of neonatal infection. So what are the measures as a nurses we have to follow is, first one is very foremost and first one is sterile techniques. So each and every time when we are handling the baby, we have to follow the sterile techniques. So next is the following practices promote the prevention of infections in the neonates. That is 5 clean practices in home delivery. That is clean surface, clean hands, clean cord tie, clean blade and clean cord stump. So this is the 5 C's that has to be followed during the home delivery. So nowadays we are encouraging each and every members to do the institutional deliveries. So only we can prevent various neonatal infections that eventually going to reduce the neonatal morbidity and the mortality rate. So we have to promote the institutional delivery to each and every members of our communities. So as a nurses, we have to educate them regarding the institutional delivery. Then only we can prevent the various complications to the mother as well as the baby that is being born. Next is strict hand washing before and after handling the babies. Use of sterile gown before entering the baby care unit, neonatal nursery and changing of shoes. So minimum handling of the newborn should be there. So unnecessarily we should not touch the babies. So unnecessarily we should not use a physical contact with the babies for IV administration, or everything has to be done in a single touch. So exclusion of infected persons or carriers from the neonatal care area. So if you feel that any caregiver is being infected, you have to immediately isolate the baby from them. So you have to avoid the contact with the infected persons. Why? Because already the baby is immunocompromised. So the baby is having the immature immune system. So what happens? They are more susceptible to the infections from the other members. Next is maintenance of cleanliness of the environment, that is delivery room, neonatal care unit, postnatal area, and separate area for the mother and baby at home. So in home also we have to isolate them and provide a proper sterile techniques. Next is use of separate disposable belongings for each baby, example clothing, feeding equipment, and etc. An aseptic cleaning of baby cot, incubators, warmer, phototherapy machines, and weighing machine, etc. should be there. So we have to provide a proper cleanliness and provide a sterile environment for the babies in order to prevent the infections in the neonates. Next is following the strict aseptic precautions for all invasive procedures, maintenance of general cleanliness of mother and baby, teaching the mother about the hygienic measures. So during the breastfeeding, how she has to do the proper cleaning of all the breast, how she has to clean it, and each and every time how she has to wipe it properly. Then separate accommodation of infected baby and outside confined baby. So you have in order to prevent the cross infections, if a baby is being infected, you have to isolate the baby from the other babies. Next is avoid the unnecessary IV fluid infections like needle pricks, and no sharing of needles and syringes should be there. So visitors to be restricted in postnatal wards. So we have to restrict the visitors as much as possible. Next is encouraging the exclusive breastfeeding. That means up to 6 months of age we have to encourage the mother to give the breastfeeding. And next is no prelactal feeding. So what is mean by prelactal feeding? That means in ancient times and in traditional times, when the baby is born, the grandmothers or grannies used to give the sugar water to the babies. So this all has to be prevented. Why? Because the excessive sugar content, it will overload the kidney of them and liver of the babies. So in order to prevent that, we have to avoid the prelactal feeds like sugar, water, or honey. And strict aseptic measures should be followed during the breastfeeding as well as the artificial feeding. Next is prevention and treatment of maternal infections in antenatal and postnatal period. So once we are treating the infections of the antenatal mothers during the mothers during her antenatal period itself, it will prevent the infections of the neonates also. So once we have to provide a sterile and therapeutic environment for the antenatal mothers and the postnatal mothers. So far we have discussed about the neonatal infections. So what are the different neonatal infections the baby may acquire with? So in what ways the infections get acquired to the babies, like due to the infected birth canals or improper handling of the babies, or due to the immunocompromised babies of being transmitted the infections from the other babies. That's all about the identification and classification of the neonatal infections. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it, and subscribe it. Thank you for watching.